Hello, I'm Callie Kelsey, the PTSA co-president at Degano Middle School. And on behalf of Degano Middle School PTSA, I would like to thank everyone for joining us this evening. I would also like to thank Rady Children's Hospital for partnering with us for this special parent engagement series. This webinar is being recorded and will be posted on the PTSA website as it becomes available. To start this evening, I would like to introduce someone that I admire very much, Ms. Dominique Hensler. Since joining Rady Children's in 1998, Ms. Hensler has served in various leadership, strategic implementation, and project management roles in healthcare administration. She currently serves as the Senior Director for Care, Redesign, and Mental Health Integration, with a focus on transforming mental health and emotional well-being to improve the health status of youth and families. Ms. Hensler believes that a focus on family-centered care is essential to transform care and improve the health of patient populations. So here she is, Ms. Hensler, to tell us a little more about Rady Children's.
Thank you, Kelly, so much for that very warm welcome. Good evening, everyone. I'm Dominique Hensler, and we are so excited to be with you tonight to talk about tips and strategies that we as parents can incorporate into our lives to support children's emotional well-being. With COVID-19, children more than ever are experiencing many stressors. So are we, right, as parents? And so we're partnering with our primary care partners, and I am honored to have my colleague here, Dr. Hilary Bowers, to kick off this parent speaker series with you. Dr. Bowers is the founding director of behavioral health at Children's Primary Care Medical Group, which is unique for a primary care physician to pursue and do. And Hilary and I, along with our teams, are working on transforming mental health. Depression and anxiety is skyrocketing. We need to get upstream and figure out what's going wrong and prevent it or identify it early and do what we can to help children and youth. So I'll turn it back over to Callie. Thank you very much for having us this evening. We're excited to be here to help and support in any way we can.
Thank you so much, Dominique. Now for the Woman of the Hour, Dr. Hilary Bowers is the founding director of Behavioral and Mental Health Services at Children's Primary Care Medical Group. She is spearheading the CPCMG Mental Health Initiative to create centers of excellence to improve the delivery of mental health care to children and adolescents. CPCMG provides health care at 29 offices across San Diego and Riverside counties and serves the needs of 280,000 children. It's a lot of children. You guys are amazing. Dr. Bowers, with her husband of 23 years, are the proud parents of 5 children. She has been active in numerous ways in their schools, chairing gala fundraisers, playing room parent, treasurer of the PTO, and as a board member she's served. In addition, she has always been an active member of their synagogue. Dr. Bowers has been an invited speaker to a number of multidisciplinary conferences addressing the delivery of behavioral and mental health care. In addition, she regularly interacts with Southern California's pediatric communities in a number of capacities. She is committed to bringing mental health care into the primary care home and is a passionate advocate for improved and timely access to quality pediatric, behavioral, and mental health care. While listening to Dr. Bowers, please feel free to write questions in the Q&A box if you're inspired to. The question and answer session will directly follow Dr. Bowers' presentation. Dr. Bowers, I now turn the time over to you.
Thank you so much for that very, very warm introduction. And thank you everybody who is online. I can't see you, but I see all your little squares and your letters. So I really appreciate you taking the time out of your evening. I know often that means that you're away from your kids for another hour. So I appreciate you taking the time to join us in this important discussion. And hopefully you'll be able to glean a thing or two and be able to share it with 1 or 2 or 3 of your friends who can then share it with more friends. So that is how we will continue to help all of our children. One thing I'd like to say to start off is we're going to start off with some facts and statistics, kind of get us all on the same page of where we're seeing our children and adolescents as well as their parents, sort of pre-COVID as well as current COVID times, and then transition over to things that we can do. So the first part is going to be a little heavy, not just because there's a lot of statistics, but because this very serious topic. But I want you to remember, as you're hearing all this information, that there's absolutely things that you can do as a parent, as an advocate for the neighbor's child, as a teacher, as a lawyer, as a principal, whatever role you play out in the community, there are things you can do to help reach out to our children and adolescents. So on that note, may we have the next slide, please? So what is our why? 20% of children and adolescents will be diagnosed with some behavioral mental health diagnosis. So this could be ADHD, it's anxiety, it's depression, schizophrenia, bipolar disorder, but 20%. So that's 1 in 5, which is a lot. About 33% are receiving appropriate care. So that means, 67% are not, which is just not okay. And for many children, it's 10 years between their first presentation of having these symptoms of their behavioral mental health diagnosis and actually receiving appropriate care. About 50% of parents are unaware that their child may be having thoughts of suicide. And 75% in a recent study saying that parents were unaware that their children were thinking about death. So if we're having children with these, they're not receiving appropriate care, then we're seeing increased risky behaviors, such as increased suicidal thoughts, injury, early sexual debut, so increased sexual activity, decreased educational achievement. So maybe we're skipping school, maybe we're just underachieving. We're showing up, but we're not doing the work. Next slide, please. So in the emergency department, where sometimes this is the first place that kids will present, about 3%, it's gone up slightly during what I like to think of as the COVID times, about 3% of ED visits are due to behavioral mental health, about 10% of hospitalizations. And as we said, greater than 50% have had no prior mental health care. So showing up in the ER, which can be a very scary place when you're struggling and the family's struggling and everything is very stressful, this is the first time. And what we'd like to do, as Dominique said earlier, is we'd like to have these people be able to reach out to healthcare sooner rather than later. As we know, unfortunately, if someone does have a major depressive episode early in their life, they're more likely to have it later. Now, again, during this first episode, if they're able to get the care that they really need, if they're able to build their foundation, then they can recover sooner. And that next episode might be 5 years, it might be 10 years, it could be 30 years down the road. But if we build the foundation now, then even if they hit that next dip in the road, they're going to recognize it sooner. They can activate their bench and hopefully not go down quite as much. What is an increased risk for showing up in the ER and having no prior mental health care? Lower socioeconomic status, not having a primary care doctor, younger age, so 14 to 17, and living in a rural environment. So this next slide is a lot. There really isn't another way to say it, but the US suicide rate, so this is from 2000 to 2018, unfortunately suicide is now the second leading cause of death behind accidents for teenagers. And this is something that I think as a society, we should really work towards changing, right? An accident is an accident, but suicide means that somebody was struggling so much, felt like they couldn't reach out, and they felt their only recourse at that point was to remove themselves from their life. From 2007 to 2017, so over the course of a decade, teen suicide rate increased by 56%. So even just saying these statistics, even though I've seen them a lot, even though, as everyone said, I'm sort of quote, live in the behavioral mental health world, every time I say this, it really gives me chills in my arms because it makes me feel like we're not doing enough to help our children. Next slide, please. This one looks at the self-inflicted injury and hospitalization. This would be North County coastal region. So this would be up in your neighborhood. As you can see, the orange graph, the line down at the bottom is looking the 0 to 14-year-olds. And really what we're showing is that self-inflicted injury, this could be non-suicidal self-harm, cutting, has gone up. And it's going up. So, 50 up to 100. So this is, again, this is a significant increase. Next slide, please. If we break it out, the suicide rate by age group, and I know this is sometimes a little hard to see on Zoom with the little tiny squiggles. So we kind of outlined in red the 10 to 14-year-old age group. So these are the kids that are in middle school, junior high. I grew up in the Midwest. We call it junior high. It still comes out sometimes. That the female box is on the left and the male box is on the right. And so what you can see, it's actually really low for a very, very, very long time. And then starting about 2012, we see this increase in female, 10 to 14. And so at this point, it's almost tripled, which is huge. I mean, think about it, that a 10 to 14-year-old thinking that this is the answer to their challenges. So again, this is tripling. Please, next slide. I don't know if any of you have seen the movie The Social Dilemma on Netflix, or perhaps heard the TED Talk or Cedar Speak. Jean Twig from SDSU is a psychologist there. She wrote the book iGen and really has talked a lot about what's happened since 2009. So there's a lot of speculation that, come 2009, what happened? We had mobile phones, right? And then we had smartphones, and the smartphones were getting in the hands of not just the adults, but, younger kids as well. And what we're seeing during this time period, so over the past decade, that she's done in her books and her TED Talks, and now we see illustrated in the Netflix movie, The Social Dilemma, which I had no part of, just in case anyone's asking, that we've seen suicide by girls, again, age 10 to 14, going up by 151% in a decade. That self-harm is almost tripled, that children and young adults and adolescents are not, they're not seeing this is again pre-COVID, we're not going out and seeing friends face to face. They were not getting jobs after school. They were not getting a driver's license as soon as they could. Kind of this, what some people talk about as failure to adulting, that they're so consumed and everything is now turned inward, and you're constantly following the likes and the loves and the hearts and the squeezies and the thumbs up and the tweets and everything else. And that is how we're getting our dopamine rush. That's how we're getting validated. And it's through a little box. This has become more of a challenge during COVID when we've socially isolated, right? And so now maybe potentially the only way you can talk to someone is through a little box. But thinking about this, thinking about how you're having constant feedback on, are you good enough? Did you wear the right pair of pants to school, right? Was your hair curled in a certain way? Did you make the team, right? And it used to be you go to school and you may or may not be bullied, you may or may not be in the in-group or whatever it was, but then you got to go home. And presuming your home life was stable, obviously some people unfortunately do not have a stable home life, but if it is, then you could ignore school, right? So you had this sort of, what I think of as this box around school. So in the mornings, in the evenings, on the weekends, it was better, right? But now, because we have basically school and all the social stuff following us 24/7, people will post, hey, there was a party and da-da-da. And so somebody's scrolling through and they're like, oh, I missed out. Like, how come they didn't invite me? And it may be they didn't invite you because they knew you already had plans to do something else, or they knew you were out of town, or it was an activity that they could only invite one friend. And so they invited the friend that lived next door to them because that was more convenient for the family. It doesn't matter because you feel left out. And now you're thinking about this. Now, instead of doing homework, you're looking at what everyone else is doing. Now, instead of, going to bed at night, your brain is chattering. And this becomes a 24/7 situation. And unfortunately, 10 to 14-year-olds think I'm the only one. I'm the only one suffering. And also, like, who do I talk to, right? You don't want to admit that anyone has a problem, that anyone has a challenge, right? Because if I'm challenged, I must be the only one who's doing it, because everybody else, if you look at their Instagram feed, everyone else looks fantastic. So looking at this data and saying over the past 10 years, we've seen suicide go up, we've seen self-harm go up, that there is something that we really need to think and pivot about within our society. Next slide, please. So, recent survey of about 1,300 US girls, and again, this is reiterating things we've said, that 1 in 4 are stating that they're depressed, 96% are missing school. A lot of kids with anxiety, their stomach hurts when they get up, right? They don't eat breakfast. Well, now you don't eat breakfast, now I'm hungry, so by the time you get to lunch, your stomach hurts, I don't want to eat, or maybe nobody will sit with me at lunch, right? Or maybe I didn't like what I packed, or maybe I got that math test coming up, so now my stomach hurts again. So some kids are going all day without eating, which is not okay. Social media, American Academy of Pediatrics says, please wait for screen time till after 2 years of age, and please only have 2 or fewer, fewer's get better, 2 or fewer hours of what we think of as social media time or screen time that's non-school related. So again, pre-COVID. I know a lot of people are doing distance learning, but again, 2 hours or less of non-school related screen time. Kids are using 6+. When I ask, they'll be like, it'd probably be better to ask me how many hours I'm not on my phone, right? So that's kind of thinking about it the other way. And 80% are feeling more lonely and isolated. So despite the fact, in theory, you feel like you're more connected because you got all these friends on your Facebook, Instagram, Snapchat, I know Vine's dead, so I shouldn't mention it, Foursquare, MySpace, whatever you want to use, that you have all these friends. Are they really friends? Do they really know you? How often are you actually talking to them, right? Is it just this competition to see, oh, I have 1,000 followers. I have, 200,000 followers. I got 1 million followers, right? I don't have 1 million followers, just in case anyone's wondering. How can you keep up with that? And who's really connecting with you? I know we've talked a lot about our children, but this next slide is really going to illustrate, how about the caregivers, right? So if our caregivers are struggling, if the parents are struggling, how are they going to be able to fill the cup of the child if they're not filling their own cup? And so this is just in comparing springtime 2019 to springtime 2020, that anxiety and depressive disorder has really skyrocketed. So again, remember March 13th, 2020 was a day that schools shut in San Diego County. And since then, people have become isolated emotionally, physically, school-wise. A recent study showing that about 30% of parents, and I guess this really shows, this slide illustrates that, are saying that their own personal mental health is down. So if your personal mental health is down, that's a bigger ask. It's a bigger struggle. It's a bigger rock to climb to say, okay, I'm not taking care of myself. My mental health is down. How am I going to take care of my child? Am I even thinking about my child, right? So as we said earlier, many parents have no clue that their child is struggling. Everyone has their own little box that they're operating in. And if you don't take the time to ask, if you don't take the time to be in your kid's business, I highly recommend being in their business, then you're not going to know, because they usually just don't volunteer it. About 14% of parents in this study felt that their kids' mental health had gone down. Food insecurity, housing insecurity has increased during the same time as well. So you think if you don't have enough food to eat, you're depressed, that you're not getting out of the house, where am I going to live? Most parents will give, food to their children if they don't have enough through the month, but there's no reason that anyone should not have enough to get through the month. So if you don't have enough food, then your brain's not working the way that it should. Depression, anxiety go up, and it becomes this real downward spiral. So thinking about how can we do this? Okay, we're now doing an abrupt transition from the heavy statistics portion to the slightly more optimistic, how can I help my kids? How can I help the neighbor child down the street who I think is struggling, and I think their parents just don't have a clue, right? How can I help the kid at church or synagogue or mosque or Baha'i, at temple? Where can I be that person? Where can I be that trusted adult? So one thing is to acknowledge for yourself is to really be in the now. This is a time of change. Acknowledge it. It's okay to say it stinks. It's okay to say to your kid, gee, it is what it is. I wish it wasn't. Or these are the things I would change if I could. Or, this is what I remember liking about the past. But these are some things that weren't so great about the past. And this is something that's better now. A lot of families now, because they're together, many families now are having family dinner again that they weren't because they were going to soccer practice, or they had gymnastics, or their, theater class ran late, or whatever it was. So breathe into these differences, find the positive in them. The other thing is I hear a lot of people saying, just wish things would go back to normal. It'd be really awesome. Can we just have them go back to normal? And I like to reframe that and think, what does normal really mean, right? Normal is whatever you're doing now. So the question is, are you happy with now? And if the answer is no, how can we change that? Can we take some things from the past that we learned and that this was good? Again, personally, when my kids stopped going to school in person in mid-March, I kind of liked it because I didn't have to drive so much, right? That morning rush of like, okay, come on, get up. Okay, put on your shoes. Okay, is your lunch packed? Oh, and you all get out to the car and then you come back because someone forgot their lunchbox, you forgot the backpack or whatever. And it was kind of nice to sleep in a little bit. Much to my children's chagrin, I did not let them completely get out of sleep phase. We did still have to get up by 8 o'clock, 9 o'clock in the morning. We weren't sleeping in till noon or 1 o'clock in the afternoon, but having that slower to wake up time was really beautiful, and being able to sit and have breakfast together was really beautiful. So how can we take those things and really be in the now and say, okay, let's bring that forward for us. Next slide, please. A colleague of mine from undergrad, Kaplan Mowbray, said this is really an OMG moment. And what a lot of people think OMG stands for, but in his case, he reframed it as optimism, magic, and gratitude. And these are really muscles that you can cultivate. So optimism, stay positive, right? Yes, this is uncertain. Yes, we don't know what rug's going to be pulled out from under us next. Yes, we have an election coming up and it's very exciting, but what kind of things can we look forward to? What's the magic in life? One thing we do, one of my daughters came home from school today and I was asking what's something that's great that happened to you today? Or what's something that was a challenge that you were able to overcome? And she said one of her teachers came up to her and said, hey, tell me something that somebody said nice about you today, which I thought was really interesting because he wanted to learn something new about her, but he was also cultivating the expectation that people are saying nice things about other people and that you should take the time to find the nice thing, right? Where is that magic? How can you look for ways to disrupt your own cadence? And then gratitude, right? We all are going to have, quote, good and, quote, bad times, but the things that are going skating smoothly versus the things maybe a little bumpy, a little challenging. What can we learn? There is something to learn from every situation. One of my examples that I like to share is I used to work at Dick's Drive-In. This was during a period of time after college where I was supporting myself fully. And I had the closing shift. They were open till 2 a.m. So Dick's Drive-In in Seattle is like in and out. It's a very limited menu. They have, hand scooped ice cream and stuff like that. It was a Saturday night and it was Halloween. So I think you can imagine that after bars close, that burger joints like that are pretty busy, right? And so it was just full on. People were just cramming the window. Some people got not very polite. And I had a manager who came up, there was a customer in my window, my manager came up and said, nope, you can move aside, this is my job, right? If this customer is not gonna be polite, I am the one, I'm where the buck stops here, and I'm in charge of that. And I thought that was always a fabulous lesson that, a manager really should take care of their employees, a parent should take care of their children. And for me, it's an example of how you can learn something from every job, right? Did I want to scoop ice cream for the rest of my career? Obviously not. I went and became a doctor, but that's, it's a human that helped me in a time of need, and it's something that I always remember. So how can you find these gratitude moments? Some people do that in a very concrete way. They'll keep a gratitude jar, maybe right in the middle of the kitchen island with a pad of paper and a pen right by it. So there's no excuse, I can't find something to write with. And just as inspiration strikes, you write things and you stick them in the jar. And then once a week, you shake a few out. Or if you're having a rough day, you shake a few out and remind yourself, what am I grateful for, right? So that can be a real family event. Some people keep a personal gratitude journal. So every night you write down one thing that you're grateful for. You can work up to like 3 or 5, but I always say start with the easy, start with one. And as you're cultivating that, again, you're going to start cultivating that gratitude muscle. And if you do that, that's where your brain's going to go more often than maybe some of that more negative things, because it's very easy to dwell on the negative. Next slide, please. So development in children, these serve and return interactions. We think about that a lot when kids are very young. We think with babies, we go goo goo gaga, and we smile, and the babies smile back at us, or we wave something and they want to wave back at us. But this is still important in junior high. It's still important in high school, right? It's important for a parent to be present, right? When your child comes and says, I have a headache, you can respond by saying, you're fine, go away. I got stuff to do. Or here, go take some Tylenol. Or you can sit and say, hey, why do you think you have a headache, right? Put some of that, I'm here to listen. I'm not necessarily here to solve all your problems, but I'm here to be on the journey with you to solve your challenges, right? So I can be a sounding board. Most of the time, teenagers, adolescents, they don't necessarily want our opinions, and they don't necessarily want us to have a quick answer. They really just want us to listen. They want us to be there. You may notice some of your children come to you right when you're trying to go to bed, after you've asked all day and all night and all afternoon, hey, you want to talk? Or you've talked about things and they're like, no, I'm busy, bye, 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 bye. And then as everyone's going to bed and you finally got it and you're thinking, yes, I have a few moments, they come in and they're like, hey, mom, can I have a hug? Or like, hey, dad, can we talk about something? And you're really tired. Always tired. But that's the time when they're letting their guard down. And that's the time when you need to say, yes, I can give you a hug. Absolutely. And maybe that's all they wanted. Maybe they didn't want a 3-hour soliloquy, but sometimes that's when they kind of, all the chatter in their head shut off so they can think about their challenges and think, okay, you know what? I'm going to reach out to my trusted adult, who's my parent or my grandparent or my aunt or my uncle, whoever it is, and I'm going to ask for help. I think it's really important, especially in COVID times, maintaining social connections. Human beings are social creatures by nature. We need to have that one-to-one. We need to have that something. Every kid usually has at least one BFF, may not be all of them, but they have at least one. And having that connection of that human and me giving you a question, you coming back, we work on a project together, whatever it is really important. It's why some kids go to school. They're not interested in the academics. They go to school for lunch and recess and seeing their friends. And for me, okay, fine, you're showing up, but now we don't even have that, right? Like you're seeing your friends like you're seeing me in a little tiny box, and the teachers disabled the chat feature. So how are we still going to maintain that? Talking to people on video chat is something I recommended pre-COVID, and especially something now. We did in our family, we set up some piano concerts with my grandfather who was in Florida, and there were people to put an iPad in his room, and then we had our action. And so he got to see his great granddaughters play piano. And it was a real highlight of his day. And it brought some joy, it brought joy to him. It felt, my children felt good because they were able to give something, gave them some purpose in their day. They were able to share their skill with somebody else. And then also the caregivers, because he lived in a nursing home, the caregivers got to enjoy something as well, a little, again, disrupting the cadence, a little something out of the routine. You can go old school and write letters, new school, write emails, but you can get out the pen and paper. It's kind of a nice sneaky way of working on penmanship and spelling, creative writing. I usually keep a stack of postcards from random places, so putting that in. And then remember, it's okay to say hello. When you go outside for a walk, it's okay to say hi to your neighbors and to wave. Maybe baking for the neighbor down the street and leaving it at a socially distanced way with a little note to say, hey, we're thinking about you. Maybe baking a meal for an elderly neighbor down the street, or maybe a not so elderly neighbor. Maybe you just have things you'd like to share. Next slide, please. Taking a break is really important. As I said before, acknowledging that this is a stressful time is okay, but finding ways to make that community. Having unstructured video time is okay, but we don't want that to take over our whole life. And then for adults, again, this is really challenging because many of us are all home all the time. All the time. It's great. And you can't have adult time, but it's very, very important that adult discussions remain adult discussions. So if there's things that I like to call them president and CEO, whoever's in the house, whoever runs the house, the adult people, if they need to have a discussion, finances, food, whatever it is, something just their personal relationship, that needs to be in a location where the kids are not. Because, turning off the news, it's okay to do that. It's okay to turn it off. I had, unfortunately, some families, again, at the beginning in March, it was just 24/7 news cycle on and on and on. And their children were becoming really anxious. And it was hard for them to hear all this because their parents were anxious, the kids were anxious. So finding ways of turning it off, watching some dorky movie, we watch Nailed It a lot. It makes me laugh really, really, really hard. And then we try to recreate it, right? So then we have our own little cooking shows at home. But doing things like that, because then you're watching a screen time together, but you're doing it as a family, and then you're incorporating an activity. And again, as adults, making sure you're obtaining the appropriate resources for your family and community. So there's unemployment, food, housing, schooling. 211 San Diego is very helpful in connecting with resources. And again, if we're maintaining our community, reaching out to your friends, talking to them, having these conversations is very important. Next slide, please. So I think the big takeaway from this slide is there's lots of different ways to cope, right? And the key thing here is finding what is the right way for your teen, right? Or your preteen. My daughter said when she turned 10, she was zero teen because she was very excited to grow up. But our preteens and adolescents, like, what are their coping skills? Journaling is great for people who like to write. It's not so great for people who writing is a struggle, right? So having one coping skill that a lot of parents like is breathing. So you breathe in through your nose, through 4, you can hold it. Some people call it box breathing. Some people call it conscious breathing. So you breathe in, you hold it, and you breathe out. And so you breathe out longer than you breathe in. So if you have a child who's having panic or worry, or they're having an anxiety attack, and the parent is saying, breathe, breathe, just breathe. Breathing's so great. It's so fabulous. Just do it. And the kid thinks breathing is really dark and it's frustrating. And so that then escalates things. So taking the time before the stressful moment of what are the things that speak to you? What are the things that speak to your child? What are things that tend to activate your stressful moments? And put them in writing. Have a family moment. Everyone knows what everyone else's triggers are. Put them in writing. And then what are your coping skills? What are your coping skills as a parent? And what are your child's coping skills, right? Because then you're now empowering your child to help you. So they see that you're struggling and frustrated. If they know what helps you, they'll come up and they'll be like, hey mom, let's go take a walk. I don't want to take a walk. Come on, mom, let's go take a walk, right? Or let's just sit and watch this movie together. Oh my gosh, I saw this really funny thing. I wanted to tell you this joke, because they know humor helps you. And now they can stand a little taller because, like, wow, I helped my parent in their time of struggle. And it can become a much more two-way relationship. Planting, gardening has the added benefit of being outside. Get a little vitamin D in your life, I think is really important. Listening to music. A lot of my patients will listen to music before they go to bed. It's just an unwinding. I try to encourage them to do it with a non-screen device. So sometimes this is old school CDs, tape deck. If I'm trying to be really funny, I mentioned 8-track. They look at me like I'm weird because they don't know what an 8-track is. The parents laugh. So, but having some music, because it's very easy. If you're listening to music on a screen device, then now I'm watching the video, now I'm looking at the next thing. But if it's just the music, maybe I'm listening to a podcast or a meditation app, that's great, because then your brain will focus on that instead of all the chatter of the day. Next slide, please. So again, coping skills for parents, you can see a lot of overlap. I think some very important things is sleep hygiene. We talk to our children a lot, you gotta go to bed, you gotta get up, you gotta have good sleep hygiene. At this age, it's a good 9 to 11 hours of sleep every night. And you can't make up lost sleep. So just because you're sleeping, 15 hours on the weekend doesn't make up for the fact that you're sleeping only 6 or 7 during the school week. The other thing to remember is 7 is really a magic number, but less than 7 hours of sleep as humans increase anxiety, increase depression, decrease self-worth, increase self-harm, increase risky behavior, decrease school performance. So if you're really having a struggle, your kids are getting only 5 hours of sleep, at least get them to 7. Try to stretch it, keep going, I empower you. But getting at least to 7 is really important. Daily movement, walking outside, connecting with your community. I think some of the most important things about coping techniques for parents is that you're modeling the behavior you would like your child to do. So telling them to get off the screen while you're sitting on your phone during dinner is not going to work, right? It's just not. So if they come and talk to you, put it down, because whatever it is, unless your house is on fire, it can wait usually, right? It can wait a few minutes. So modeling the behavior you want them to do is going to be really useful. One journaling item I wanted to bring up is the concept of a color journal. So some people, words are very hard, or eyeball to eyeball is very hard. So texting your parents can be useful. Keeping an open diary, which is the idea where, the child will write something in the diary and then they put it on their parent's pillow. And then, the grandparent writes back and then they put it under the kid's pillow. And so this way you're still having the conversation without having to do it eyeball to eyeball, which can be very kind of scary and intimidating. Another idea for a journal is what we call a color journal. So you draw out a bunch of colors and then you assign a feeling to each color, whatever that means to that person. So I like red. So for me, red is happy, but other people may view red as angry. But whatever it is, you have red, orange, yellow, green, blue, purple, black, brown, whatever colors you want. They all have an emotion. And then every day you assign 1 or 2 colors to that day. And that's very brief, it's very quick. And so when you go back at the end of the week and you look at your journal, it's really easy to see how your week was or your month was. And it gives you an opportunity as a parent to go back and say, Wednesdays and Thursdays, they're not so great. And it's always Wednesdays and Thursdays are not so great. This is very clear. So let's sit down and let's think about, let's troubleshoot that and think about why Wednesdays and Thursdays are not so great. So really gives you that very quick journaling and then insight potentially into your child. Next slide, please. So in the time of COVID, you cannot not mention the 3 W's, right? So wearing a mask, washing your hands, watching your distance. So how do we reduce the risk of COVID-19, the SARS-CoV-2 virus? Through the 3 W's, right? So again, by demonstrating these 3 W's to your child, it makes the virus a little less scary, right? You have a little more control over what's going on around you. I don't know what to do, it's coming, it could be anywhere. Well, you know what? If we wear a face covering, that's decreasing us spreading it to someone else or someone else spreading it to us. If we wash our hands, which hopefully we were doing anyway, but we should really be doing it now. Soap and water for 20 seconds, so sing the alphabet song twice. Some kids are going to school in person, some people are not, some people are just using a lot of hand sanitizer. I'd like to remind you that after using hand sanitizer, alcohol-based hand sanitizer 5 times, that you need to use soap and water again. There are very good studies showing that the bacteria just come back. So 5 times alcohol, then soap and water again. The other thing to look out for is a lot of times kids and adults as well will develop a rash on the back of their hands on the dorsum part from overuse of hand sanitizer. So again, if you're using hand sanitizer, make sure you're also using a lot of hand lotion to keep your skin barrier intact. Because if that's breaking down, now it's potentially increased bacteria. And then watch your distance. So 6 feet, stay 6 feet apart and someone hacks a loogie, it's a lot harder for them to get it on you than if you're standing right next to them, right? So the 3 W's, wear a mask, wash your hands, watch your distance. Next slide, please. The other thing to remember is you're not alone, right? We can feel very isolated right now, but there is lots of help. I highly recommend that you talk to your pediatrician if your child is struggling. They want to hear you. They are not just the shot doctor. They want to talk about your child. They want to talk about your child's development. Many of you may have been with the same doctor since your kid was born, or some of you may be going to the doctor that you saw as growing up. So they are there, they're part of your bench and can be activated anytime to help you. So reach out and talk to them. If you're concerned about going into the office physically, which hopefully you're not, CPCMG has been open the whole time and very clear, but if you are, video visits are always available. Things to think about in an emergency: Rady Children's Hospital ER is open 24 hours a day, 7 days a week. If you're having challenges getting your child into the car and it's not safe and they are not safe, then you call 911 and you bring the hospital to you. Children's Behavioral Health Urgent Care is located down on University Avenue. They have walk-in clinic from 4 p.m. to 8 p.m. The Rady Children's ER, their psychiatric ER, is open, so that way it's a whole separate space where it's calmer and less chaotic. The Access and Crisis line is on there. In the upper right-hand column, you see this National Suicide Prevention Lifeline, which is 800-237-8255. I highly recommend everyone has that in their cell phone. And again, not because I have secret knowledge about what your child may or may not be doing, but in a crisis, it's always good to not have to go fumbling for things. And you may be the one that your best friend kid comes and talks to. And being able to share that is available 24 hours a day, 7 days a week. The idea is they're just there to listen. And for some kids, that is the only person they have to listen. So that is available. These slides will be available, excuse me, after this talk as well. 211 San Diego, as I mentioned earlier, for food insecurity, housing, unemployment. The San Diego Food Bank has expanded their locations. And there's also up in Riverside County Department of Public Health. So there's many, many, many resources, and you are not alone, which I think is the most important thing to remember. Children's Primary Care Medical Group, cpcmg.net, Rady Children's website, Children's Physician Medical Group. So we all have great resources, and we're here to help and we're here to listen. Next slide, please. All right, so I think we're into the question section, which is very exciting. So somebody, I think, is manning the Q&A, womaning the Q&A in this case, personing the Q&A.
Thank you so much, Dr. Bowers. Thank you so much for all of that great information and for sharing ideas and thoughts as to what we can be doing as parents to support ourselves as well as our children. It's so funny that you brought up the journaling thing, because I got this in the mail today. It's called Just Between Us, Mother and Daughter, a No Stress, No Rules Journal. And it was literally $10 on Amazon. And I got it for myself and my daughter. So, you know, I love what you said, and there are easy ways to implement some of these things in our lives. So thank you for the thoughts and ideas, and let's go ahead and get to questions. At what point is it more important to worry about my child's mental health than it is to push them in their assignments at school? And along with that is, how can we balance both?
So I think sitting down and having a talk with your child is always important. You know, was your child a straight A student before, right? And now you're seeing their kind of C's or D's. Were they very social, and now you see them starting to withdraw? And even online, they're not connecting with their friends. Did they used to come to the family dinner, no problem, and now they're like, yeah, I'm not so hungry. Nah, I'll just get something later. And then you go to clean up their room and you're finding all these wrappers upstairs. So clearly they're eating, but it's not healthy. It's at odd times. You hear them wandering around at night. If your child's mental health is not okay, they're not going to do well academically. It's just not going to happen. And so I'm not a huge fan of pushing, but sitting down and saying, hey, I've noticed a little bit of a change, and then universalize it. A lot of people are struggling right now, right? You're not the only one. It's not to say that you're not special. It's not to say I don't care about you, but to say that, you're struggling, your friends are struggling, right? And they're like, oh no, they're all getting A's, they're all doing great. But the thing is, you don't know at what cost that is. And so if the cost is all of your mental health and all of your sanity in order to keep up appearances and keep up straight A's, then it's not worth it in my mind, right? I would rather have the child, drop down. So we have kids that are doing well academically, thank goodness. But one of my high schoolers came to me and she said, you know what, I want to just drop a level in this class. Like I have all these classes this term and I feel like these ones are more important to me, and I'm feeling overwhelmed. And thank goodness she's able to come to me and say that, probably because I hound her all the time, but she say that. And we're like, yes, absolutely. Right? I mean, is there a reason you have to take another AP? Like, is that in the long run really going to do it? Or how about if we say, oh, we'll take honors or regular instead of AP, but you do quality work and you're able to have a little more time to socialize and you're feeling good about yourself? That to me goes a long way. Because in the long run, what are we trying to achieve? Are we trying to achieve a bunch of 4.0 students? Like not everyone's going to be valedictorian. It's just not going to happen. Or are we trying to create better human beings? And in my mind, we're trying to create really functional human beings. And so how can we do that? And so I think to follow up on that, you as a parent to model that behavior, right? Can you say no to a meeting? Can you commit to being home for dinner at, certain days of the week? Can you say, hey, we're going to have a 24-hour, we have no electronics in our house for 24 hours each 7-day period. So Friday night to Saturday night. Can you do that as a family and say, we're going to have no electronics, which means we're going to play games, we're going to do books. You got to plan ahead a little, but maybe you do a little journaling together, or you get together and say, hey, we're going to take a walk. We're going to do some nature photography, explore something new, but it's going to be no electronics. So it encourages that face-to-face communication.
Thank you so much for that. Second question is, what are some tools we can give our teens to help them advocate for themselves with their own mental health?
So I think with that is, one is modeling the behavior. So you acknowledging if you're stressed, like your kids know, you don't hide it very well, most parents, right? They know if you're stressed out, they know if you're mad, they know if you're angry. So, you name it to tame it and say, dude, I am frustrated right now. I looked up this really great recipe. I spent all this time making a new meal for my family. I asked somebody to set the table and hello, the table's not set. People are ripping stuff off the walls. They're screaming and yelling. You think the circus moved into my house, right? I'm upset. And this is why I'm upset. Right? And this is how I would like to not be upset. Like this is how we can help solve and not have mommy be mad. So modeling this behavior, I'd like to think of myself as a walking tour guide. So you're constantly saying what's on your mind. And if you model that, your children will kind of pick up on it some more. How can they do it? If they're having a challenge or, maybe they came home and said, Joey was a real pain in the hoo-ha at school or whatever. Say, oh, okay, so tell me about what happened? Well, Joey was a pain. Well, what did Joey do that was a pain? Well, they kicked me. Okay, so what happened right before the kicking? Well, I don't know. Okay, so what happened right before the kicking, right? And so you really kind of go through and you get this whole vision of what really happened. And then you walk through and say, okay, well, what are some things? Okay, so you kicked Joey back. So that's kind of a bummer. What are some other ways that perhaps we could have, dealt with that situation without kicking? And then you role play. So I find role playing to be very helpful because it's you and your kid or you and the other kids, and they can make fun, you can dress up, whatever. You say, okay. And often as a parent, I say, you be the one that's sort of the weaker, if you will, right? You be the other one. So your kid can be the strong one. And say, okay, how could we do this? And so you play it out. And you're like, oh, well, that didn't go as planned. Well, let's try a different tact. So giving that role play, giving them words to say instead of. I think another thing is when your child asks you a question, and I'm not modeling this behavior right now, but when your child asks you a question, give an answer and then stop talking, right? And wait and sort of see, hey, what else is going on? Maybe you ask them, maybe they're struggling at school, and you can say, hey, would you like me to talk to the teacher? Or would you like to talk to the teacher together, right? What are we hoping to accomplish by talking to the teacher? So really think through these things before they have to be in that moment is really useful. Another thing can be if you're going to a new situation and maybe they have a little social anxiety, pre-think, okay, this is where I'm going to be. Hey, there's this other parent there that you totally know. So if I'm whatever, you can't find me, you can absolutely go to that person as well. So planning ahead for scary situations, I think, is also important.
Thank you so much for that. This next question is actually a multiple part question. How much alone time is appropriate for teens? When should I be concerned that my daughter is disconnecting too much? What type of effort should I put toward connecting more with my daughter? And how can I keep from getting overwhelmed in this process?
So I think one is to make sure that you're maintaining your own social connection. So what is your community? And are you taking the time to spend with them, right? And by that I meant whatever sort of, if you're doing it face-to-face, if you're doing it online, if you're seeing a therapist, right? And I think that's okay to acknowledge. It's okay to see a therapist, because I look at therapists as coaches to say, hey, here's somebody who can help me. Maybe I don't have all the skills that I want. So how can I bounce that off that other person? In terms of how much alone time is too much, I like to look at change. So maybe your kid would be in their room for an hour every night, but now it's 3 hours, right? And it's not 3 hours of I'm logged on to Zoom school or distance learning school. It's 3 hours, no school time. You know, they were doing this and now you're, maybe you have sensors at home and you're seeing your kids up at 1 a.m. So what is the change from where they were before? If there is a change, that should be always addressed. I think it's very important if you're living with other humans that you spend time with the other humans, right? So we have structured meal time. Maybe it's breakfast every day together you expect everyone to be at. Maybe it's lunch, maybe it's dinner, maybe it's all three, whatever it is, but that this is an expectation of this family, right? If you don't like what's for dinner, my kids will tell you, like, if you don't like what's for dinner, you get to eat it anyway. But that doesn't work for every kid, obviously. But thinking about, all right, you don't like what we're making, how can you be part of that process? So involving them, drawing them out indirectly. It's not like, oh, we have enforced, you know, now's the time we recreate together. It's more, okay, you know, Thursday night, Joe's gonna make dinner and we're gonna do it together. So we get to do a little recipe time together. Maybe we'll go shopping together. Maybe we'll cook together. So now you've just created 3 different time periods where you're interacting with your child without it feeling like a very forced, now is the time you must share all of your emotions with me, right? So creating these multiple opportunities to share and to grow. Personally, I think it's very important to be in the business of your children, right? Knowing who they hang out with, who are their friends, who are their friends' parents, who are their friends' parents, you know, how the more you can surround your child with a community that's reinforcing what you're trying to teach your child, the more successful you will be in teaching your child those things, right? About 75% of who we are is genetic, which gives us about 25% to play with, you know, in terms of rounding and softening those edges. Kids kind of come out as they come out. But if you surround them with people, they don't have to be exactly like you. So I don't want anyone to leave here thinking that Dr. Bowers said, I can only hang out with people, you know, Dr. Bowers only has her kids hang out with people who have curly hair and glasses, right? I mean, that's not the case. My kids will attest to that. But are there core values that you're trying to teach your children? And are the people you're with, do they support those core values, whatever those are, right? And that's really what I'm trying to say. I have a couple children in the background who may or may not make an appearance. They're giggling. So I think that's really important. Your kids want to be heard. Your children want to be loved, and they want to be seen and acknowledged. All right, I guess I'm getting a thumbs up. They want to be seen and acknowledged. And so again, just being present and being with them, it counts. So lying down and reading a book together. I try to read quite a few of the books that my kids read so we can talk about them. Again, that's a kind of on the fly thing to think about. Or when you're driving your kids to school, when we were driving our kids to school, maybe as the kids are going with you to the grocery store or wherever you're going to the beach, you know, think about setting an intention. If it's in the morning, what's one goal we have for the day, right? And then are we keeping that goal? Just to piggyback off of what you said earlier, I think keeping a schedule and keeping a routine is very important, because that way you can see those changes, because it's when you see the change that it's really hard. So get a whiteboard, put up your kid's schedule. You got to be out of bed by this time. This is what time we're logged on. This is what time we're off. This is what time we play games. You know, this is what time we go bike riding. This is what time we eat lunch. So I think a lot of times when people think about schedule, they think about work and they think about school, and it's like, but you can have fun, like schedule your downtime, schedule the time you're going to be on, you know, Instagram, and you're going to post and you're going to look at silly stories and stuff. Because if you don't, what happens is that slips in and you become unhappy that you're online all line. You become unhappy that you have to work all the time, and you start like looking at your phone, and then you're sneaking it, and then you scroll, and then like a half an hour goes by, and then an hour goes by, right? And so if you schedule the time, it's a lot easier to keep you honest. It's something I've been encouraging parents to do, is keep office hours. So put up their schedule and then have an hour or two different times of the day where the parents are available, whatever. It gives the parents time to schedule the rest of their day, right? Because inevitably we all know, what time does your kid come ask you for math homework help? Right at the time you were about to take a shower or finish the dishes or whatever, sit down to do your like end of day work, whatever it was. But if you have office hours, then they know, okay, this is the time I can get my parents' attention, no problem, no questions asked, whatever I need. And so it helps everyone schedule their day a little more. It helps make things go a little smoother. Hopefully that answered your question.
I think it was fabulous. Thank you so much. Another question is, socializing is such a big part of my child's life. What do you think is a healthy way for teens to connect and get outdoors together while still keeping them as safe as necessary?
So a lot of people have several friends they may have already done a pod with, sort of these are the people you're kind of hanging out with. And so seeing those people face to face, you can have driveway play dates. I know a lot of middle schoolers don't call them play dates anymore, but driveway play dates where you can be in the driveway, you can be 6 feet apart, you can wear a mask, but you can still see each other. And there's something about actually seeing each other, plus then they're outside, which is great social time. My daughter's nodding a lot right now, which is really important, is great. Having, going bike riding is a great outdoor activity, you know, physical exercise, but you're not right on top of each other, right? It's not like we're doing wrestling where you clearly are sharing airspace. You can go on a hike together, which is a great way to socialize, but yet maintain healthy distance. Sunshine is beautiful. It kills viruses. It's really fantastic. You know, swimming, I think having some online connections can be very useful, but be mindful of who your child is connecting with online. Unfortunately, again, we all know, we've all seen that cartoon, right? The dog at the computer where it says, haha, on the internet, nobody knows I'm a dog. So it's the same thing, right? Nobody knows who you're connecting with. So try to have people, if your kids are online, have them connect with people they know IRL, right? In real life. Sometimes people come in and their best friend lives in Korea. They met them online. They have no idea who they really are. And now your kid's sleep cycles, well, I have to stay up till midnight because that's when my friend gets home from school or whatever. And so now your kid's sleep phase is completely out of whack. They're not doing their schoolwork. But again, it's that change of, if you were keeping track of what they were doing, then you see the change in behavior, then you're like, okay, what's really triggering this? So I think having that is really important, being aware of who they're interacting with online.
Thank you so much. I actually have one last question, which is just what do you think has been the most significant increase that you have seen through CPCMG or Rady Children's Hospital through COVID? Is it anxiety, depression, or what have you seen with the adolescents?
So I've seen a lot of changes with anxiety. So some kids who had really significant social anxiety in the before times, pre-COVID, right? They didn't want to go to school for whatever reason. There was really big social anxiety. For some of those kids, the social anxiety got a lot better, right? They were in their happy place. They were home. It was fantastic. They didn't have to go outside ever, which isn't really addressing their social anxiety. It's just kind of letting them go to where they don't have to address it, which in the long run is not really what I want to see. But for many kids over the course of the summer, the anxiety went really up, because you're seeing, and then what can really follow is depression. Sometimes depression comes without anxiety. But as the summer went on, as teens are more and more physically disconnected from their friends. So remember, with adolescents, what is that developmental stage? It is finding your identity, right? So we're going from concrete thinkers, like black and white, if I do this, this happens, to really a little more abstract thinking. And also, who am I? I mean, this is why teenagers, they're dressed all in black one week, and then the next week they're dressed in rainbow, and then the next week they're dressed like a leprechaun, and the next week they join the band, and 3 weeks later now they're in orchestra. It's because they're trying to figure out who they are, right? I read Psychology Today like all the time, and then I got into marketing magazines, and whatever it was, you're like all into it, and it's so meaningful until it's not, and then you've moved on to something else. But what you're trying to find is, you're trying to find your people, right? You're trying to find your group as an adolescent. And so adolescents naturally should be kind of separating a little bit from the nuclear family, right? They should want to go out and hang out with their friends. They should want to go bike until the sun goes down. And we're not letting them do that, right? We're not letting them do, for health reasons, but we're not letting them do what they would want to be doing developmentally. And so then what happens is they become depressed, right? They're just like, well, what's the point? What I'm hearing a lot of is, what's the point? What's the purpose? Why bother, right? And so I think as parents, we have to work maybe triply hard to make sure that our child has a purpose. So I know, again, with distance learning, I've seen across the county everything from no learning to 1 hour of Zoom instruction per week per class, to maybe 2 hours of instruction per week across all classes, to 8 to noon, to 8 to 3 nonstop Zoom. So that is a huge range, right? And I'm guessing some of you have been on all day Zoom meetings. I know for me personally, I've had some all day where you're like back to back to back to back to back to back to Zoom. By about hour 3, and I got 7 hours total, by hour 3, my brain's a little mushy, right? It's a little, you're like, and we're asking our children to do this, right? And lunch is short, and they're not getting outside during lunchtime. So how can we, and again, some of the teaching is really easy. Some of it, the teachers are recording. I've heard of some teachers that are just recording the lectures. It's not live. Now imagine having a middle schooler watching recorded lectures all day. If they raise their hand, there's no feedback. Hopefully I'm not offending anybody. But these are the things that I've heard about across the county, and that the live interaction is huge. So how can you find a purpose to the day? What's the point of sitting in this class? What am I getting out of it? And if your child's previous purpose of school was to socialize and to be with their friends at lunchtime, how can we find a way maybe to have lunch if there's other neighborhood kids that are in your kid's class, they have a break at the same time, let's have a picnic outside, right? Let's rotate which parent's in charge, of lunch every day, and let everyone come sit around on the table, and you can have single serving things, you can make it so we're not sharing everything. But how do we get that social interaction again? I mentioned earlier the delivering food, and my kids like to bake a lot, so we baked a lot. And so as to not gain a lot of weight during the early COVID times, we gave a lot of it away because it's delicious. And so we'd wrap it up, and they loved walking to the neighbors, and you like ring the doorbell and walk away and leave it down, and they would write little notes to them. And it was great because it gave them a purpose. I'm bringing joy to somebody else. The neighbors liked it because their grandkids aren't around, so they get to see little grandkids and they get to get a fun note. And it gives you something, thinking about how creative ways to volunteer. How can you get that purpose? Maybe I write letters. I know there's definitely some nursing homes around the country who have advertised, like, write a letter to somebody, because these people, their families can't visit them. COVID has shut down nursing home visitations. And so now they're very, very isolated. And they're older and they have memory issues. So your children can participate. You can write a letter to someone, hey, this is what I did today. We went on a bike ride and we looked at the ocean or whatever. And it's great because it works on your kids' writing skills. And then again, they could bring that purpose to somebody else.
Right. And Hilary, I was going to add to that, when a child or even adult gives to someone else, the phrase is true. In the giving we receive. And it does something, it lights up the brain if you look at scans, where if a child writes that note for the person in a nursing home, or bakes and gives a note to an elder neighbor, it can do so much for their positive well-being and lifting their spirit as well as the recipient. It's a really important protective factor of resiliency.
Mm-hmm. Thank you, Dominique. It's having those trusted adults in your life goes a long way. They found with trauma, people who've unfortunately experienced trauma during their lives and ACEs, adverse childhood experiences, having one trusted adult is a huge resiliency factor. Just one. It can be a parent, but it could be a coach. It can be a teacher. It could be a pastor. It could be George, who lives down the street, and it's just that guy in the neighborhood who watches out for everyone in a good way, right? And helps kids learn how to ride their bike. It can be anybody. It could be the uncle or the aunt or, a cousin, but having that one trusted adult in their life that is that touch point is a huge resiliency, and kids do remember that. Any other questions?
I think that we are good on questions, but I just want to express so much gratitude to everyone that's here tonight listening, as well as everyone from Rady Children's and CPCMG. I know that I am going away from this feeling invigorated, ready to take on tomorrow, and having new ideas and solutions to concerns that, I feel like I'm doing great, and then all of a sudden 3 kids need something at the same time, and I'm like, so I appreciate all of the thoughts and ideas that you gave tonight, and I can't thank you enough for that insight and the ideas. I'm very, very grateful, and from the entire Degano Middle School PTSA, thank you for being here and participating.
It's absolutely my pleasure. I really believe, if you save a life, you save the world. So the fact that you're telling me you learned something that you'll implement tomorrow is fantastic. And then you have the butterfly ripple effect. So thank you for inviting me. I really appreciate the audience.
Thank you. All right.
Thank you, Callie, for setting this up. We really appreciate it.
Absolutely. Thank you for taking the time, and I hope everyone has a great evening.
You too. Good night, everyone. Thank you.